Hi everybody. Now I am going to discuss about antibiotics. Antibiotics can be defined as the chemical substances produced by microorganisms that can inhibit the growth or kill microorganisms. Antibiotics aren't effective against viral infections. This includes the common cold, flu, most cough and sore throats. It is a secondary metabolite of microorganisms. Antibiotics were first discovered by Alexander Fleming. Antibiotics are antimicrobics or antimicrobial chemotherapy. Antibiotics binds to proteins or cellular organelles and disrupt essential functions necessary for the growth and survival of microorganisms. Antibiotics may inhibit or kill microorganisms, that is, bacteriostatic or bactericidal. Fungi and actinomycetes are the major microbes that produce antibiotics. Altogether, about 2000 antibiotics have been characterized so far, but only about 50 are used therapeutically. Some viruses cause symptoms that resemble bacterial infection, and some bacteria can cause symptoms that resemble viral infection. What are resistant bacteria? Each time you take an antibiotic, bacteria are killed. Sometimes bacteria causing infections are already resistant to prescribed antibiotics. Bacteria may also become resistant during treatment of an infection. Resistant bacteria do not respond to the antibiotics and continue to cause infection. A common misconception is that your person's body becomes resistant to specific medicines. However, it is the bacteria, not people, that become resistant to the medicines. General properties of antibiotics. Selective toxicity. Antimicrobial agent must selectively affect pathogens and not for the host cell. Therapeutic dose. Dose of the antibiotic required to kill pathogen. Toxic dose. Dose of the antibiotic which kills the host itself. Therapeutic index. It is the ratio of the toxic dose to the therapeutic dose. Larger the therapeutic index, better the chemotherapeutic agent. A drug should not produce hypersensitivity allergy in the host cell. A drug must be soluble in body fluids so that it can rapidly penetrate body tissues. An antimicrobial agent may either sedal or static effect. Microorganisms should not readily become resistant to an that drug. Spectrum of activity. Broad spectrum antibiotics can attack wide variety of organisms. Example tetracycline act on gram positive or gram negative bacteria. Narrow spectrum antibiotics can attack particular organism. Example bacitracin acts it can act on gram positive bacteria only, not on gram negative bacteria. Types of antibiotics. What are the 10 most common antibiotics? Aminoglycosides, cephalosporins, penicillins, monobactams, carbaminoms, fluoroquinolones, macrolides, sulfonamides, tetracyclines, trimethoprim. First antibiotic widely used in medicine field, penicillin. Penicillin was first discovered Alexander Fleming. This is the first antibiotics. The sources: Penicillium chrysogenum, Penicillium notatum, It is a narrow spectrum active against a variety of gram-positive and low against gram-negative organisms. It is very active against staphylococci that do not produce penicillinase, streptococci and spirochetes. These are widely used to treat a variety of infections, including skin infection, chest infection, UTI, urinary tract infection. And next one is cephalosporins. These can be used to treat a wide range of infection. Some are also effective for treating more serious infections like that septicemia, meningitis, and source Cephalosporium acremonium, broad spectrum antibiotics. Its structure resembles to that of penicillin. Patients who are allergic to penicillin is treated with cephalosporin. It is effective against gram-positive and gram-negative organisms. Mode of action: it inhibits transpeptidation reaction during peptidoglycan synthesis. It is bactericidal activity. It is active against Pseudomonas aeruginosa. And last one is vancomycin. Source Streptomyces orientalis. It is a glycopeptide antibiotic. Mode of action: it inhibits transpeptidation, step break the cross links adjacent peptidoglycans in a strand. It is bactericidal activity. It is active against Staphylococci, Clostridium, Bacillus, Streptococcus, Enterococcus. It is very toxic drug and narrow spectrum antibiotics. It is used for treating streptococcal endocarditis. Route of administration: orally intravenously. Thank you.